If you work in emergency medicine or in any scenario where you may be taking care of patients who have pain pumps, specifically intrathecal pumps. The one that I have come across is baclofen, intrathecal baclofen pumps. You need to know what to do if that pump malfunctions. What I have come across is a patient's intrathecal baclofen pump suddenly stopping the flow of baclofen. And intrathecal means basically into the spinal fluid. It's a little outside of the spinal cavity. So the patient has been getting a direct flow of intrathecal baclofen. And if you just look at the dose is pretty low. It's 90 micrograms an hour, but it's continuous. And the fact that the patient has been getting this continuous stream of baclofen into their spinal fluid means all of their GABA receptors are upregulated. It's a similar mechanism to what happens with people who drink a lot of alcohol or are on chronic benzodiazepines. And if you know anything about withdrawal from benzos or alcohol, the patients can occasionally start seizing and simply never stop, and we want to avoid that. Now, if you look directly at the dose, 90 micrograms per hour is about 2 milligrams a day. I did go do that math on a calculator. My brain didn't do that. Don't be confused. Which sounds insane because baclofen is like 10 milligrams a dose orally. That, again, intrathecal and oral, not the same thing. You cannot physically give enough oral baclofen to overcome the intrathecal baclofen the patient was getting through their continuous infusion from their pump. So this is an emergency. The pump needs to be fixed as soon as possible. The patient needs to be transferred to somewhere where the pump can be fixed by either the neurosurgeon who put their pump in, maintenances their pump, whoever takes care of their pump, or someone else who can do it soon. Because if it truly is stopped cold turkey, we're going to have a problem. If you come across this, a patient with a malfunctioning intrathecal baclofen pump or pain pump of any sort, you can immediately call poison control. They will help you to determine, is this a malfunctioning pump? They will give you resources. They'll give you phone numbers. That is what I did. I called poison control. They gave me a number for typical devices that the patient might have, so I could do some investigating, figure out what exact pump he had, and then call the 1-800 number. I didn't end up doing that because the patient that I came across, we transferred away to someone who could fix their pump. They gave me signs and symptoms to look out for, whether it be a completely blocked pump or the opposite. They said very, very rarely, but possible, that the pump could administer too much medication to the patient, which would cause different symptoms. So again, call poison control, figure out where the pump is taken care of, and get the patient to there so that their pump can be fixed. Because again, you cannot overcome it with oral baclofen. Last thing, because I have been asked this, there's no intravenous baclofen. There's only oral and intrathecal. Also, I never said it. Baclofen is a muscle relaxer. It decreases spasms. So if the pump stops, the patient will most likely have an increase in the spasming that caused them to get the pump in the first place. That's often the first sign.